Maintaining blood pressure is critical for cardiovascular homeostasis. Too little blood flow to an area like the brain can cause dizziness and fainting. Adjusting three variables helps in regulating blood pressure. Those three variables are cardiac output, peripheral resistance, and blood volume. We can show the relationship of these variables with this equation. Pressure equals cardiac output times resistance. That means that anything that increases either cardiac output or resistance would also increase pressure. Previously, we saw that cardiac output is the product of stroke volume and heart rate. That means that anything that increases either stroke volume or heart rate would also increase cardiac output, which would also increase pressure. We've also seen that resistance is caused by things like viscosity, vessel length, and especially vessel diameter. An increase in viscosity or an increase in length would increase resistance and cause an increase in pressure. A decrease in vessel diameter would also increase resistance and increase pressure. That's a lot of different variables to keep track of, so let's take a look at a bigger picture idea. We're interested in maintaining mean arterial pressure. We can do that by adjusting either cardiac output or peripheral resistance. Cardiac output is the product of stroke volume and heart rate. An increase in either stroke volume or heart rate would increase cardiac output and would increase pressure. Peripheral resistance is caused by blood vessel diameter, blood viscosity, and blood vessel length. Again, an increase in viscosity or length would increase resistance, which would increase pressure. Out of all of these variables, the only one that would decrease to cause increased pressure is the diameter of a blood vessel. There are two classes of mechanisms for regulating blood pressure. Short-term regulation using neural inputs and blood-borne hormones. These change peripheral resistance or cardiac output. And there is long-term regulation, which alters blood volume at the kidneys. Our short-term regulations include both neural and hormonal controls. Neural input can regulate cardiac output, and it can also regulate peripheral resistance by adjusting the diameter of a blood vessel. Sympathetic signals can increase the heart rate, which would increase cardiac output, and it can also increase contractility. Those neural signals can also adjust the diameter of arterioles by controlling the tunica media of the arterioles. Most neural controls of blood pressure operate through reflex arcs using baroreceptors, that is, receptors that adjust to pressure. Stretch of an artery sends signals to the cardiovascular center of the medulla oblongata. Signals coming from the medulla can cause vasodilation and decreased cardiac output. That would cause a decrease in pressure in the system. A decrease in stretch to a blood vessel also sends signals to the cardiovascular center of the medulla oblongata. Signals from the medulla result in vasoconstriction and increased cardiac output, meaning that if our blood vessels aren't stretched as much, we can do things like vasoconstrict our blood vessels to increase pressure back up towards normal again. Some chemoreceptors also influence our control using neural inputs, especially those for carbon dioxide and changes in pH. Hormones can also adjust cardiac output and peripheral resistance to provide some short-term controls for blood pressure. Epinephrine and norepinephrine are hormones associated with a fight-or-flight kind of response, and the presence of either of those would increase cardiac output by increasing heart rate and contractility, but they also directly cause an increase in peripheral resistance by vasoconstricting arterioles. Angiotensin II increases peripheral resistance by causing a contraction or vasoconstriction at the arterioles. ANP can cause a decrease in peripheral resistance because it's a powerful vasodilator of arterioles. Antidiuretic hormone can increase our blood pressure by increasing blood volume, but also by vasoconstricting arterioles. And aldosterone can also increase blood volume, which would thereby increase blood pressure in the system. Long-term controls of blood pressure do so by altering blood volume rather than by altering cardiac output or peripheral resistance. The kidneys mediate these long-term kinds of controls through adjusting water retention. Retaining water increases blood volume and thereby increases blood pressure. Excreting water decreases blood volume and thereby decreases blood pressure. The kidneys have both a direct and indirect regulation over blood pressure. The direct renal control does not rely on hormones and happens directly at the kidneys. Increased blood volume, and because of that increased pressure, increases flow into the nephrons. Because there's more blood flowing into the nephrons, this increases the rate of filtration that's happening at the glomerulus. This increased filtration increases the pressure within the renal tubules, which causes fluid to be excreted at a higher rate. As we lose that water through excretion, it decreases blood volume and brings our blood pressure back down. This was a response to increased blood pressure in the first place, so we increased excretion and thereby decreased blood pressure. The opposite happens when blood volume and pressure are too low. Fluid spends more time in the kidney tubules and thereby increases reabsorption. Because we are retaining a greater proportion of water, it helps us increase blood pressure. The kidney's indirect mechanism rely on the release of different hormones. When blood pressure declines, the kidneys release an enzyme called renin. The action of renin is to cleave angiotensin into its active form called angiotensin I. Angiotensin I is then converted into its even more active form called angiotensin II by another enzyme called angiotensin converting enzyme. Angiotensin II acts in 4 ways to increase blood pressure. It stimulates the release of aldosterone from the adrenal cortex. It stimulates the release of antidiuretic hormone from the posterior pituitary. It triggers the hypothalamus's thirst response, thereby increasing water intake, thereby increasing our blood volume and blood pressure. And angiotensin II also causes vasoconstriction directly so that it can increase peripheral resistance.